Thank you for joining us today for the VU Limited Practical Guides for Getting Back to Work series. The focus of today's webinar is on the health and safety issues of returning to work. Everyone has joined the webinar in listen-only mode. Please use the chat box to ask questions as we go. My coordinator will look out for these and bring them to my attention. And we'll also have time for questions and answers at the end. I'm Victor Ubogu, founder of VU Limited, a sports travel and hospitality business. Alongside me are Peter Kinselley, an associate director of Cardinus Risk Management, a health and safety expert with global experience and over 20 years of successfully implementing health and safety management systems within large corporations. Peter has extensive knowledge of fleet safety, emergency and business continuity planning, working and influencing teams within a multidisciplinary environment. Hi, Peter.
Hi, Victor. How are you?
Yep, I'm all good, thanks. And you?
Yeah, I'm good, thank you.
Jonathan Webb, co-founder of Fortius Clinic, a leading orthopedic and sports medicine clinic in London. Jonathan specializes in knee surgery and sports medicine. The former Bath and England rugby fullback has operated on a global array of international athletes. Hi, Jonathan.
Hi, Victor. You didn't mention Bristol there.
I don't care about Bristol.
Clearly.
We also have my former front row colleague at Bath, Lee Mears, who went on to play for England and the British and Irish Lions. Lee is now an executive coach at Preston Associates and teams to perform at their best. Public speaker, angel investor, and is one of the founders of Teacup, the wellbeing app, which we'll hear more about later. Hi, Lee.
Vic, how you doing?
Yeah, good, mate. At this point, we don't know when live events will be back up and running as we know it. I've had to adapt in the interim from sports, travel, and hospitality to bulk selling PPE, as well as Teacup, the wellbeing app, and health and safety e-training. It's not live sporting events, but I've had to adapt. As pubs, restaurants, and other workplaces opened last weekend, business owners and managers have a duty of care to safeguard the psychological and physical safety of their staff and customers. Failure to meet these obligations may leave them exposed to legal claims. How many companies can demonstrate that they've taken all reasonable steps to ensure a COVID-19 secure workplace? I mean, for those planning the reopening of their workplaces, Peter, can you please update us on the current government guidelines?
Victor, thank you. So the first thing that I'll ask everybody to do is actually look at the government information that's actually out there. So there is a website, government.uk, Coronavirus Business Support. And the latest update we've got is dated the 3rd of July. Now, it's really important that you actually do keep up to date with this, because actually it gives you all the sector information for you to actually help your business reopen. It's also important that if you're in one of our regional parts of England, so Wales, Northern Ireland and Scotland, that you also follow the local government advice. Now, the latest update actually gives information on things such as local lockdown requirements, so it is important to keep up to date. But the government requires each of the sectors to consider, as part of their reopening, the following things. So they need to carry out a risk assessment, develop cleaning, hand washing and hygiene procedures, maintain 2-metre social distancing wherever possible. And those 2 points are really key to this. Okay, it's not 1 metre plus, it's very much 2 metres, unless you work in environments such as hairdressing, where you actually need to get, close to somebody, and then you need to have specific requirements in place for that as well. So you've got to actually make sure that you're managing the transmission risk. And then the last thing you need to consider is that wherever possible, allow people to work from home. And this is a really important part. Now, from the information that the government provides, it's really clearly written. It gives you nice guidance and information And also it requires each employer to share this information with their own employees. And in each sector a document that's provided by the government, there is a quite clear requirement on this. From a HSE perspective, the guidance actually just covers 5 points. That's cleaning and hygiene, which is very much about making sure that you are preparing your business for reopening, that you've undertaken your risk assessment, that you've protected home workers, and I'm sure Lee will touch on this as part of it, because part of that is also making sure that you're managing work-related stress. And then the last two other areas are social distancing and PPE, which is the subject you just touched on, Victor.
Thanks, Peter, for the update. I mean, there are some free advice and support documents on your website, the Cardinals website, and I'll provide the links in my post-webinar email. So it's all fair and square, listening to the and reading the government guidelines changing constantly. I mean, what practical steps do I need to take to ensure a COVID-secure workplace, and also to convince my staff of their safety to return to work?
We're recommending actually that you take 4 steps. So that is very much prepare your business to return to work, make sure you inform staff that you are coming back to work, ensure that you prevent a secondary spike, which is really important, so prevent transmission, and then also look at the lessons that you've learned from this particular outbreak, and also you look at your business recovery plans, which is really important. I'll just briefly go over the 4 steps to give everybody a little bit more information. So the bit around preparing the business to come back needs to be actually broken down into a number of areas. So one is about making sure the building is ready to return. So this is your cleaning, your social distancing, and making sure that you've got the correct signage for people to understand what's needed from them from work. The second one can be a little bit more complex, and that's around asking your staff who can come back to work, because we have got those that are in vulnerable groups and may still require to shield. We also need to look at actually who can we bring back to work. So for smaller organisations that can be an easy ask, but for the bigger organisations the workspace may be such that could provide a degree of complications. And then we've got other issues around things such as that the schools have not returned back yet, and also people may be caring for vulnerable individuals in their household. So we need to actually think about that. And then the last one is travel arrangements, because actually if people are reliant upon public transport, then that can create secondary issues. There is also the issue around workplace distancing. And again, if you work in a single place which is quite small, very easy to establish the right sort of protocols. Where you work in a multi-tenanted business, you're going to have to work with other businesses to make sure that you get your arrival and departure right, that the building's being maintained appropriately and cleaned in those public areas, and also make sure that you're working very much as a group, and it gives us an opportunity to sort of work closer with people than we have done in the past. And then the other thing to consider about is actually the whole anxiety of returning back to work. And again, I'm sure that Lee will touch on this on this, but this becomes actually very much a thing where leadership in business need to give people confidence to be able to return to work in a way that actually gives them the confidence that we've done the right things. It's also important that leadership at this stage is also engaged and involved in the whole process. From an informed perspective, we need to actually induct people back. We've had people away from work from now somewhere in the region of 100 days, and it's a new environment for them to come back to. So it's really important that what we do is we give them the right information. And again, it's really important that the people that are leading the business actually own this and take responsibility for that return to work. And we need to actually keep reinforcing to people this whole thing around, wash your hands, make sure that you socially distance. And we've got to keep reinforcing this, because those are the 2 measures that are going to keep us fit and healthy for the long term. And this then comes down to the whole prevent part of, getting people back to work. And that's about making sure that people understand that when you enter the workplace, that you potentially are going to touch an awful lot of areas, that others are also going to touch. So it's going to be whether you use the welfare facilities, or you're opening doors, or you're making yourself a coffee. You've got to really consider what you're doing. And again, it comes back to keep reinforcing these issues around health and hygiene. Wash your hands, sanitize, keep your social distance. Really important key messages. And I think it's also the other thing about prevention is reinforcing to people that keeping yourself healthy is really important as well. So, encouraging people to get away from using cars and public transport, and, getting people to walk and cycle. I think this is really important, as part of the processes that we go through. And then the last bit about recovery. So actually, what is it we can learn from this lockdown period? So as a business, is there anything, takeaways that we can get? So for instance, with us within a business, what we've found is that we've actually got closer to people within the teams because we've had more regular meetings. We've actually made a lot more effort about keeping in contact. So again, what can we learn? And then the last bit is that if you remember the first frantic days when we went down into lockdown, was our move into the new world effective, or is there stuff that we can learn about that can actually help us further into the future? So I would recommend that type of approach. I think there's another thing that I would just like to pick up on as part of this as well. So, you mentioned about PPE. PPE is a really important thing at the moment to keep reinforcing, keep people's anxiety levels at a good place. So wearing face masks on public transport is a real must, and actually where you're feeling comfortable, you should, wear it. But please bear in mind that PPE and the hierarchy of controls is your last resort. So, it's important that we do bear in mind that, washing your hands, social distancing come further up those hierarchy of controls. So it's really important that we keep reinforcing it. And again, coming back to that point, make sure your leadership team's engaged, make sure they're giving good messages out. But I'll leave Lee to pick that up.
Thanks, Peter. I mean, there are a couple of 30-minute e-learning courses I can recommend that employees can do before returning to work, which will give them some comfort and help to ease their fears. The first was a COVID-19 returning to work induction course and a COVID-19 compliance officer course. And I will provide links in my post-webinar email. One thing you mentioned was that staff are likely to be experiencing a vast range of feelings as they prepare to return to work, ranging from anxiety to anger, resentment, childcare issues, the possibility of redundancy, financial stress, the effect of lockdown, and impact of bereavements. I mean, this is bound to take a toll on mental health. Lee, what practical advice can you give to managers on dealing with these scenarios as they attempt to get the teams back to work and performing at their best?
Yes, well, I mean, it's a really interesting point. Peter sort of teed me up quite nicely in that the leadership team, more than ever, and we always know that leadership teams are so key to businesses running, they are integral to this at the moment. And whereas before it's always been about IQ and having the knowledge, EQ now, emotional intelligence is the new gold standard. As a leadership team, you have to walk in the shoes of your employees. Whether you've got that sort of energy depleted extrovert, whether you've got the energized introvert who's been loving being locked away and being able to get through, they will all have different feelings around moving into it going back to the new norm. And I think you really have to spend some time not looking in the business but looking on the business, and how do you integrate these people back. So for me, it is trying to walk in everybody's shoes and understand what could really be worrying them. We all know with change that the biggest blocker to change is fear. And as a leadership team, you'll be looking to really find out what those fears are and how do you alleviate them. It's a well-marked, sort of well-used phrase, but psychological safety. How do you make your staff feel safe to return, and how do you make them feel safe in the office. And it's about interaction. The more you ask these questions, and we say it all the time with leadership, but it's about listening and finding out what everybody wants. So really, for me, anything from today is just walk a mile in your employees' shoes and understand what they're thinking before you go into solution mode.
I mean, as you say, Lee, with the mental health issues that are bound to arise due to the pandemic, it is vital that the leadership teams monitor the mental health of their staff. I mean, there are various apps in the marketplace that can help with well-being, such as Headspace, Shine, Thrive, and Teacup. Lee, as a co-founder of Teacup, can you tell us more about it, please?
Yeah, I mean, Teacup was really interesting. We were sort of designing a wellness app. Our vision was to try and help 5 million people thrive. And it's more of a reflection tool on how do you reflect what the makeup of your wellness, whether that's health and fitness, whether that's success at work, whether that's diet and exercise. And we designed this tool in the idea that you could really help your staff thrive, but also as a management tool, you could start to just monitor, and help monitor people in different areas. And then obviously COVID kicked off, which we weren't prepared for, but it's become an amazing tool because now you don't have that interaction with your staff. You can't just walk around and ask those questions, how are you feeling? So this tool has been fantastic for us to actually get in the moment data on how your staff are feeling and how is their wellness. So it's really exploding onto the market, and it's come at quite a nice time because it is, it's solving the issue that we wanted to, and that's helping people thrive. If you need to know more, obviously, Vic, I'm sure you'll put it in the show notes.
Yeah, thanks, Lee. I will. Yes, thanks, Lee. I will provide info on Teacup in my post-webinar email. On to John. John, as a top surgeon and co-founder of Fortius Clinic in London, can you give us an insight of your lockdown weeks?
Yeah, well, they've been very, very different. I now work purely privately. I was in the NHS at Southmead in Bristol for 10 years, but then went private. And so private institutions have pretty much shut down for about 2 months. Both Fortius here in London, where I am now, and Nuffield in Bristol, Nuffield Chesterfield in Bristol, where I work, went into partnership with the NHS, quite rightly, to provide capacity and an ability for patients either to do orthopedic work that couldn't be done within the NHS, or to act as a step-down facility. So at Nuffield in Bristol, we had about half a dozen COVID patients who were recovering, had come out of intensive care, but still needed some hospitalization treatment. So the ability to do private orthopedic work, which is the bread and butter of what, that's what I do, became nil, basically. So I've retrained as a landscape gardener and a sous chef, but at the same time, we've had some amazing transformational views about how we work, and I'm sure Peter and Lee will concur on this. The sort of remote consultations, which is how I was able to talk to patients who needed something, was really good because they felt very comfortable going to the business about fear of coming into a hospital. Even though both our units didn't have any COVID patients in it, we all know about patients who became really worried about visiting hospital and were actually not seeking treatment when they desperately needed it because they were worried about going into the kind of center of the pandemic. So doing Zoom consultations was fantastic. And, with a remote scan done and a consultation to listen to patients, I was actually able to carry on looking after people and certainly reassuring them with the reassurance that they were sat at home and that they didn't have to travel anywhere. And I actually think, we're probably going to have a much higher proportion. I mean, I basically had 0 Zoom consultations prior to this, whereas I think moving forward, we'll probably have, I suspect, up to half and half, half and half. Some people like coming into central London, but some people find it a real challenge. If they're already working here, it's fine. So I suspect from now on, we'll have a ratio of half people who just want to chat and get a sort of an idea of what's going on with their knee, for example, or any system. So I think that sort of recognizing the fear of hospitals, and now we've started opening. Previously, what I've recognized is that people sort of got a bit irritated by sending them lots of information before they had a consultation, whereas now we've got reams of information about how we're protecting them, how we're treating them. It's not a huge step for us because clinics and hospitals are really safe, clean places. We're used to kind of, you know, wiping down a room after a patient's been in there and kind of preparing for the next patient. So it's not been a huge step up for us compared to other places of work, but actually just making people feel comfortable that it's going to be safe for them to come in if you have to see them. There are some people I have to see to examine a knee, to assess its stability, to assess it, you know, firsthand. You know, there's been some interesting situations where I've been sort of trying to look at knees as people point to where the pain is, but there comes a point when you have to actually lay hands on someone to get a clear picture of what's going on. So it's, you know, I think like a lot of people have found, it's been very challenging, but also I think there are going to be some very good aspects of it that come out of it. Some positive elements that, and sort of surgeons' work-life balance. We're notorious for getting too sucked into work and working non-stop. And there's a lot of my colleagues who've normally be, you know, pretty flat out 14-hour days. There are times I'm doing that and we're kind of going, actually, do you know what? That work-life balance really matters. So maybe not go at quite the same pace, which I think is probably good for everyone in the longer run.
Excellent. Thanks, John. A question just come in for Lee. Do you have any further reading you can suggest on emotional intelligence? Just to give a bit of background from Sean, so that he manages a large IT team across 3 continents and would like to better understand how I can motivate them.
Yeah, I mean, I was just said I've got my. I said send me an email, but there's loads of stuff out there online. Book-wise, I'm probably not sure. I think if I remember rightly, it was coined. The phrase was coined by might be Daniel Goldman, but there's lots and lots of research out there. And emotional intelligence is made up of sort of different areas. It's self-awareness, self-regulation, motivation, empathy, and social skills. And so all of those elements create, you know, your EQ. So it's understanding what's going on in someone else's situation, really trying to put yourself in their situation. When I'm coaching, I talk about influence. And so often nowadays there's a triangle, Aristotle's triangle, that basically had everybody, you know, credibility is at the top. We're all credible. We know we've got our credibility, our background, our knowledge, our degrees. Mr. Webb, obviously with his scalpel, way more qualified than I am, with my hammer and chisel. But that's how you relate to someone when you're trying to influence them. We then go straight to logic. You need to do this because you need to do this. You need to return to work. Logically, it's how it works. Of course, we'll have made it safe for you. But what we don't do is we don't address the empathy piece. And that's really key. You have to go logic, empathy, credibility. We've all got that voice in the back of our head. Well, I hope we have. I definitely have it. I might have 2 or 3 in there. But my voice is always going, who's in front of me? Who's that? Are they credible? Then it goes straight to, if you go straight to logic, it loses it. That voice comes back, not thought about me, not thinking of me, not. So you have to appease that voice. And this is the EQ. What's going on in their world? What are they thinking before you can go to logic? And there's some fantastic books out there. And like I say, I'll recommend when I get through my my notes.
Victor, can I just pick up on a point that Jonathan just raised about quality of life in this, in lockdown? This is one of the reasons why, I think it's really important we need to reflect, because I think, our quality of life has improved in certain areas of working. And I think, that's a real positive thing, particularly for me, because I'm in a similar position where, I work long days, can travel, a lot. So actually, having more control or perceived more control over your day has actually helped me considerably. You know, and I think, you know, others out there can actually learn from that. And it's really great to hear that from him.
Well, can I say, I'm fascinated to hear what Lee's just said about that triangle, because every time I see a patient, that's what you're trying to map out. It's not, okay, it's for me to, if you like, be the logical, this is what you've got, this is what we might need to do. But the key step is that understanding, what do you need? What's your expectation? What's your feeling of what's the best outcome here? Because if you don't have that, you know, I've got colleagues, thankfully not in this clinic, but you see them almost from letters where they've actually written down all the logical conclusions, but clearly they've just never connected with the patient. And so the patient just, whilst they've got the credentials, whilst they've come up with an answer, they're just not happy. They're not on board with the process. And so that's, you know, and the old days of, this is what you got, this is what we're going to do, is just no longer valid. And I think quite rightly so.
I always draw, when I'm going through this with people, I always draw almost like the old school bar graphs. I'm not the best artist in the world, but I sort of say that you go through an evolution in leadership, and you start off as you know, as an employee, and you need high IQ. You got to deliver, and you have a chart. I can't really describe it, but you have a bar graph of high IQ and a little bit of EQ. Then you go into managerial, and that EQ comes down a bit because you don't get to do that job anymore, and you're starting to manage others. So your IQ need comes down and your EQ level comes up. And then when you go into senior leadership, your EQ has to be right at the top, and the IQ, you're not really in touch. You're not even doing those jobs anymore. So that's where it's, you know, I think it's a real currency, and never before have we needed it more than in a situation like this.
That's very interesting, chaps. So, John, health and safety is of paramount importance in collision sports such as rugby. And as a member of the RFU Council and the World Council, can you share with us what steps have been taken by World Rugby to ensure the safety of players as the Premiership starts?
Yeah, it's a fascinating area. I mean, you know, to give you an insight, I sit on the RFU board, and we normally have 6 board meetings a year. Well, we basically have been doing weekly board meetings of about 2 to 3 hours ever since lockdown, because everything's been changing so quickly, and the goalposts, pardon the pun, have been moving regularly. So fundamentally, World Rugby came up with a concept of trying, you know, is it possible for us to adapt rugby to make it safer in a COVID world? And it ended up with a number of suggestions to try and essentially limit the amount of actual face-to-face contact. The prevailing view in the end of these sort of 10 rule changes was that they were pretty draconian in terms of what they would make rugby look like. And I think what they've said is, look, they're here. You're welcome to pick and choose any of these suggested rule changes. For example, cutting down the length of time scrums lasted, never resetting them, really just looking to try and come within 15 minutes of contact. But I think, you know, we looked at it in the RFU and said, it will so dramatically change the game that, you know, you might as well play touch. And just play touch, accept it, because that's kind of where it'll ultimately end up with sort of zero face-to-face contact, or just wait until there comes a tipping point when the number of cases and the prevalence of the disease is such that we plus the government in collaboration are at a point where we're happy. You know, and again, there'll be personal choice on top of that. Are you happy to play again? And I think most rugby players and clubs have been really very logical and kind of, not relaxed is the wrong word, but just happy to bide our time until, you know, we've been surveying and talking to people all the time. And talking of EQ, you know, Bill Sweeney, the current CEO, is just phenomenal. You know, huge shout out to him. He came in about a year ago, and boy, oh boy, he's come into a fast-moving world of a world of complex problems to sort out, plus COVID. But he's got, you know, phenomenal EQ and a phenomenal work drive to manage this. So I'm so pleased he's on board, because he's a big plus. And then you've got Bill Beaumont in World Rugby, again, very good statesman, and a guy at the head who's sort of holding the tiller in a pretty stormy time. But, you know, it was great to see New Zealand coming through and seeing some live games with pretty much full stadia. So, you know, almost that tantalizing hope that we will get back there and have a full Twickenham Stadium. We could do with that to get some money back in the coffers. I know everyone says the RFC is rich, but you've also got more to lose than anyone else if you don't have the money coming in. So the aim is look to make the game as safe as possible. It's going to be possibly the most risky game in terms of, you know, the face-to-face contact. You guys in the front row, I mean, I could probably go back and play rugby tomorrow, because as a fullback, you never get in contact with anyone, do you? So yeah, it's the boys up front, as always, who put in the big shifts and take the big risks. But that's what you're trying to cut down to kind of make it an acceptable risk. Life, you know, as medics, we all know about acceptable risk. You know, that there's never zero risk. And so it's always going to be ultimately a decision for the person, the institution, or the government to make a choice and draw a line and say, right, you know, we think we're at a point where there's an acceptable risk. But as an individual, you've got a choice to say, well, fine, you may say that, but I'm going to hold fire because I've got an elderly relative who's really poorly, and, you know, if I brought it back, I'd never forgive myself. So clearly that's going to be an individual choice at the end of the day.
Yeah, thanks, John. That is quite a difficult one for for World Rugby to monitor. We've got some time now for some questions and answers. So if you have any questions, please keep them coming. There's one just here. I mean, how should the new ways of working be reflected in an organization's management of risks? Peter, I think you can lead on that.
Yeah, so the real important thing is to, you know, when you look at your management of risk, you need to go down to those guidance that the government have issued. So it's really important that, you know, you look at your risk assessment, but actually you also, you know, have your plan in place. So for me, the key things about returning to work are making sure that you consider, you know, your organisation. Now, when you look at the government website, it offers advice across 11 different sectors, and those sectors are very different. So, you know, if you're working in construction or in a factory, or even in a, you know, the outdoors in a, you know, a heritage type centre, you need to have a look at this. And actually, you know, the other challenge that potentially you're going to face with is that, you know, buildings weren't designed for this type of environment. So you're going to have to take some time to plan. And I think the other important thing is that, you know, sort of sessions like this are really important, because what they do is they give you the opportunity to ask questions of experts, and I would really take advantage of that. So that would be, you know, the key thing for me. The other aspect, and coming back to, you know, flogging the dead horse on leadership, it's really important that the leadership teams really get hold of this and own it. And then from a personal responsibility side, I would, you know, talk about two things. So one is, you know, making sure that we do maintain social distancing and our personal hygiene. But I think the last one is one which is very close to me, is that we need to be kind and considerate to one another as part of this. So within managing risk, we need to actually understand that, you know, we're going to have to give ourselves time to adapt and learn about, you know, sort of the new world as it is, and also to take time to actually understand the needs and concerns of others.
Thank you, Peter. We have time for one final question. If anyone's got a question. Time for one final question. Okay. The key points I'll be taking away from today's webinar are: walk a mile in your employees' shoes. Look at tools to help employers and employees, i.e. TCAP. Logic, empathy, credibility. Follow local government advice. 4 steps: prepare, inform, prevent, and recover. And finally, a positive has to come out of this, which all take, which is on the work-life balance. Be kind and considerate. Thank you to Peter, Lee, Jonathan for sharing your experience and practical advice. Thank you all for attending. I'll email a link of today's webinar. It'll be great to get your feedback, and please share with your colleagues. The webinar will also appear as a podcast on Apple, Spotify, and other platforms. Our next practical guide for getting back to work focuses on finance and operations. This is on Tuesday, the 14th of July at noon, where I'll be joined by James Nicholson, owner and managing director of Frankie Coffee Systems UK, Charles Mayhew, director of Global Credits Recovery Limited, and Phil de Glanville, my former Bath and England captain, co-owner and director at Hanover Fox, trusted advisors in executive search. Registration is free. We're looking forward to seeing you then. Thank you and goodbye.